Okay, I'm Dr. Adam Proper. This is Michael. And I'm going to just demonstrate a little bit of an adjustment so you get an idea of what an adjustment is, but it makes what's called an audible release, in the vernacular, a crack. And we'll explain what a crack is in a little bit. But what I'm touching is a misalignment in his spine called a subluxation, all right there. And it's very gentle, and it really doesn't hurt at all, right, Mike? All right, take a little breath in and let it out, nice and relaxed, let it go. And that's all there is to it. Simple as that. The crack is in the joint, there's a fluid. So when we move the joint through a range of motion that's called the paraphysiological range of motion, there's a vacuum phenomena that's occurring. And in that vacuum phenomena, there's a kind of a popping sound. That's simply what the crack is. The crack doesn't mean anything in terms of chiropractic. We can adjust people and not get any sounds or audible releases. But in this case, with this technique, usually with the motion of the joint that we get, you get a vacuum phenomena and you hear a pop. And that's what the crack is.
Hey Doc, can I self-adjust?
So Mike, you asked a great question. Can you crack yourself? The answer is you can crack yourself, but you're not going to get a therapeutic effect. Because when chiropractors adjust the spine, and that's what we call it, an adjustment, we're looking for a specific problem where there's a misalignment that's minor, enough to cause pressure on the nervous system. So I see people coming in all the time saying, hey, can I crack my neck? Can I crack my fingers? Whatever. People do that because they have a sensation that there's something not balanced in their spine, so they'll try to crack it. So the answer is you can crack it, but you're not going to get a therapeutic effect as you would from a chiropractic adjustment, where we locate and determine where that subluxation is and reduce it.